Okay, good morning, everyone. My name is Elisa, and I'm the Health and Wellbeing Support Worker at the Primary Care Clinic. And with me and leading this webinar, it's Dr. Kate McNaughton, and she is going to be speaking and talking everything about the going back to school during COVID-19 for all of you. And this is going to be only a guidance for parents and kids. So I really hope that everyone enjoyed this and has this information very useful. So I'm gonna pass the lead of the microphone to Dr. Kate McNaughton, and at the very end of the presentation, we will have a round of questions and answer on questions, and we will be happy to answer everything for you.
Thanks, Elisa. Thank you for inviting me to be part of the webinar today. So just to introduce myself a little bit, I'm a resident doctor in family medicine. I'm doing a year of specialization in global health and vulnerable populations program at the University of Toronto. And I had the opportunity to attend clinic at FCJ a couple of times recently, and I'm very happy to be here helping out with any questions that you might have about going back to school. And just so that you know, this presentation is going to be available, I think, on the FCJ website afterwards, and Elisa will give you more details about that. And also, just so you know, we've tried to base the presentation as much as possible on the information from the different organizations like Toronto Public Health, the Toronto District School Board, Toronto Catholic District School Board, and the Ontario government. So that's where this information is coming from. And I will just let Lisa talk about the first couple of slides, and then we'll dive into COVID-19.
Okay, wonderful. Thank you, Dr. Kate. So we're going to start talking about the topic of today. It's going back to school during COVID-19. This is a guidance for parents and kids. And who FCJ are, who we are. We are a non-profit organization with services for refugees and other at risk due to their immigration status. We have many different programs actually, and it goes from the access to education, youth networking, migrants workers mobile program, anti-human trafficking, immigration help and refugee protection, settlement services, obviously the primary care clinic, shelter for women and kids, and public education. This is all the programs that we are running right now actually at the FCJ Refugee Center, and we are very happy to help everyone in need. And the agenda for today, we have the general information, health and safety, the frequently answering questions, the vaccination and flu shot, and other healthcare programs who are important, and obviously more resources and information that we have, and the Healthcare Toronto clinics for non-insured people. Regarding the questions that you are able to make, on the right side of your screen, you will have a toolbar. That toolbar is looking like you are watching right now on the screen, and you can enter questions. You can enter as much questions as you have, and then you have to click on send button. And at the very end of this webinar, we're gonna start answering all of those questions that you have. Please feel free to ask as many questions as you need, and we will try to answer everything that is in our hands. Okay. So
all right, so
yeah, go
I'm
ahead.
happy to take over here. So just to start off with, COVID-19 is a respiratory illness, and it's a new disease. So it was first appeared in 2019, and we're still learning a lot about its effects. So so there's a lot we don't know about this illness, and we're still gathering a lot of information about it. And so a lot of the things that we're going to go over today have to do with taking every precaution that we can to prevent the spread of the infection. And so a lot of the measures that your children will be experiencing when they go back to school are things that you've already been practicing since March. So physical distancing, monitoring yourself for symptoms, hand hygiene, and wearing masks. And we'll go over that in more detail throughout the presentation. We don't have any specific treatments for COVID-19 unless people are very sick. So most people will have mild symptoms. They'll be monitored at home, and with some rest and hydration drinking plenty of fluids, most people will get better. And when people get very sick, they will be monitored and they'll be admitted to the hospital, and you'll have a team to look after you if that ever happened. So just to go over some of the things that you can expect when your kids go back to school. So one of the very important things that you'll be asked to do is to do a daily screening for symptoms of your child. So the school that you go to, that your child goes to, will be giving you a screening questionnaire that you can fill out. And every day before your child goes to school, you'll just be asked to make a routine of going over the symptoms of COVID-19. So if we just go back to the previous slide for a moment, the most common symptoms you can see in the pictures there. So fever, cough, difficulty breathing, sore throat, runny nose, loss of taste or smell, generally not feeling well, or nausea, vomiting, and diarrhea. Kids and elderly people can have some non-specific symptoms, so be disoriented or confused, sleeping more than usual, feeling weak, having chills or headaches. So if when you're doing the daily screening of your child, they have any of these symptoms, you'll be asked to not have your child go to school that day and to go and get a test for COVID. And we'll talk about how you can do that in a few minutes. It's very rare for kids to become quite sick, but they can very occasionally get an illness called vasculitis. And with that, you might expect some symptoms like a prolonged persistent fever, abdominal pain, red eyes, nausea, vomiting, a rash. And these children should be going to see a doctor for medical attention. So on the next slide, we actually have an example of a screening questionnaire that parents can fill out every day with their children before they go to school. And the next slide as well has the rest of the example of the screening questionnaire. So the additional 2 questions on the questionnaire is have any of your children been in close contact with someone who is sick or has confirmed COVID-19 in the past 14 days? And has there been any travel outside of Canada in the past 14 days? So that's a little bit about the questionnaire. And then on the next, if you can just move to the next slide, thanks. So if kids are at school and they develop symptoms of COVID-19, there are a lot of measures in place to try and keep everyone safe. So every school is going to have an isolation room where a child with symptoms that may be COVID-19 will be brought, and they will be given appropriate protective equipment like a mask, and the staff member who's looking after them will also have the appropriate protective measures and equipment. So if a student or a staff member becomes ill with symptoms of COVID-19, the school will notify the parents. They'll be able to notify public health, and all the measures will be in place to do contact tracing and to find out who may have been in contact with this person, and if other people will need follow-up as well. We can go to the next slide. Great. So the second thing that's really important when kids go back to school is to practice physical distancing from other people. So all of the students who are at school are going to be grouped into what we call cohorts. So cohorts means that students will be kept in small learning groups throughout their school day, and we will limit the exposure to multiple teachers and multiple different groups of students. And this will help to limit the number of students that your child is in contact with, and it will also make contact tracing a lot more easy if someone does develop symptoms of COVID-19 and tests positive for COVID-19. So other physical distancing measures are to make sure that when the student is in class, they will try as much as possible to have students sitting at desks that are separate from one another, and each school may carry out the physical distancing in a different manner, but in a slightly different manner, but all with the same goal of trying to prevent the spread of the virus. So there will likely be separate entrances and exits to the school, and the schools will also be limiting the number of visits into the school. So non-essential visits by parents or other visitors will be limited in the school. And you can expect more information about physical distancing at your specific school. You can expect that to be communicated to you by your school. So a third measure that's going to help reduce the spread of the coronavirus is the wearing of face masks. And most of you will already be used to wearing face masks at some points when you go into stores already. So in terms of the expectations for face masks, what I can tell you right now is that students who are in kindergarten to grade 3 will be encouraged to wear face masks, but they will not be required to wear face masks. And the reason why they're not required at this point and only encouraged, there's a couple of reasons. So it may be more difficult for students in this age group to get used to wearing a mask and to wear a mask properly. So we'll talk a little bit more about how to wear a mask properly in a couple of minutes, but that's one reason. The other reason is that at a young age, interactions with other people and observing facial expressions can be very important, and so having a face mask on may limit that to some extent. Now, one thing that I would encourage you to do if you have a child in this age group or older is to practice wearing the face mask at home before you go to school. And this will help to normalize a face mask and help your child to realize that this is a normal expectation due to these times in which coronavirus is a reality. Students who are in grades 4 to 12 will be required to wear the face mask while they're in the school. There will be some exceptions to this. So some children may not be able to wear a face mask for medical reasons, and that's reasonable and expected for these students. Just to give you some additional guidance on face masks, they should fit comfortably. You can use non-medical masks, so cloth masks with 2 or more layers are appropriate. And the mask should cover your nose and your mouth. You shouldn't use plastic masks or face shields. And it be good to plan ahead and send your child to school with 2 bags for masks. So you can have one labeled clean, the other labeled dirty, and pack several masks for them each day. And when the mask is wet or visibly dirty, the child can change their mask and put the dirty mask in the bag that's labeled dirty and put on a new mask. And you can also use disposable blue masks, but once those are dirty, they shouldn't be reused. They should be thrown in the garbage. All right, so we can move to the next slide. And just so you know, there will be times when kids won't be wearing masks at school. So when they're eating and when they're outdoors and they're able to be physically distanced from other children, kids won't necessarily be expected to wear a mask. But even when they're in their small learning group, when physical distancing isn't possible, the expectation is that kids from grades 4 to 12 will be wearing a mask. Other measures that schools are going to take is they're going to increase the cleaning that they do at the school. So surfaces that are touched very often, like light switches or door handles, will be cleaned regularly. Some schools may choose to open windows to increase ventilation in the classrooms. And kids who are using the bus, it's good to know that there will be measures to clean buses more often, and it will be expected for kids to wear masks on buses when physical distancing is not possible. All right, we can go to the next slide. So we've included in this presentation a diagram on how to wash your hands with soap and water, and then also with an alcohol hand rub. And this is another great thing to do at home with your children before going back to school, is just to practice doing these things with them to reinforce the good habits. And these slides will be available later, so I won't go over every single step, but it's just important to make sure that you're washing your hands for at least 15 seconds and that you're rubbing the back of the hand, the front of the hand, in between the fingers and the nails. And then you know, the best thing is to turn off the tap with a towel rather than with your hand that you've just cleaned. And if you're using the alcohol-based hand rub, then you should be rubbing your hands until they dry. So usually at least 15 seconds or more until they're dry, and then they're clean. All right. So we already talked a little bit about what might happen when children become ill while they're at school and when we have to rule out COVID-19. And I think that, you know, every year it's a normal part of school is that kids get respiratory viruses or they get abdominal illnesses with nausea and vomiting or diarrhea. And sometimes that's not going to be COVID-19, it'll be something else. But the first step that we'll do just to protect everyone is to make sure that the child is brought to the isolation room, that they're monitored, and that we'll have their parents pick them up. And then the recommendation will be for them to get tested at a COVID-19 assessment center to make sure that it's not COVID-19. Also, I just wanted to mention also that we recognize that mental health is very important and that there's a lot of things that are going to be different this year. And there's a lot of uncertainty with this virus and lots of things that we don't know. And this can be very stressful for kids and for parents. And the schools know this, and you know, public health knows this, and so we're really trying to put measures in place to help students and their parents deal with the stress. And so one of these ways is to you know, do some webinars and information sessions like we're doing today. And another way is to talk about this with your kids, to check in with them, to talk about how things might be different this year and normalize the different steps that they'll go through when they're at school. And there's also some resources to help kids who may be struggling with stress and anxiety, and we'll give you those resources at the end of the presentation. And just to remember also that we all need to work together to try and prevent the spread of the infection. We need to be positive with each other and with other students, to include and be optimistic and try and help each other out. So now we're going to go through a few frequently asked questions about COVID-19. And some of this information may be a little bit repetitive from earlier, but it's always good to hear it again, I think, because these are probably the kind of things that are going to be occurring at the school, and so it's nice to know a little bit about it. So if someone at school is diagnosed at COVID-19, whether it's a student or a staff member, Toronto Public Health will be involved, and they will do what we call contact tracing to figure out who may have been in close contact with that individual, and recommend COVID-19 testing or self-isolation at home for any student who may be at risk of having been exposed to COVID-19. It's important to note that we want to keep help preserve the confidentiality of patients and people who are diagnosed with COVID-19. So the name of the person with COVID-19 will not be shared. And this is really, we all want to be conscious of not stigmatizing any students or staff who develop this virus. And so just remembering to be inclusive and respectful of other people. So the next question is, what should I do if my child is sick? So the recommendation, if your child has any symptoms, is to get tested for COVID-19. And you can do that at a COVID-19 assessment center. And like I said, we will show you some resources to find out how to access a center. If the COVID-19 test is negative, a child who is sick should stay at home until 24 hours after their symptoms resolve. If the COVID-19 test is positive, the child will be followed by public health. They will be monitoring the symptoms to make sure that it's mild, or to give you access to more medical care if needed. And you will be asked to self-isolate, so the whole family to self-isolate for 14 days or longer if symptoms persist. And Toronto Public Health will be monitoring throughout and will give you advice on what to do. So we can go to the next slide. Okay, so again, if your child has any flu or cold symptoms, nausea or vomiting, diarrhea, definitely you should take them to be tested if they have signs of illness. And the child and anybody in the household who is in close contact will also need to self-isolate until you receive the test results. We can go to the next slide. All right, so if the school that you go to, if there's a student there or a staff member who tests positive for COVID-19, do my family and I need to be tested? So this will depend on the circumstances. And one of the reasons why we have cohorts at school, or the small groups, is so that the close contact between students is limited to a small group. So if somebody tests positive at school, Toronto Public Health will be involved in determining who may have been in close contact with that student or staff member. And that won't be all of the kids at the school. So it will likely be people who were in the same cohort or who had contact with the staff member. And so that will be determined by Toronto Public Health. They will let you know if you need to be tested. And we expect there to be a lower rate of virus transmission with all of the physical distancing, mask wearing, and hand hygiene that will be encouraged at school. And the next question is, what doctor should my child see if they receive a diagnosis of COVID-19? So if your child has a diagnosis of COVID-19, if you have a doctor, a family doctor, you should phone them and let them know that you've received this diagnosis. You'll be expected to remain in self-isolation with your child, and Toronto Public Health will organize the monitoring and follow-up of your symptoms to make sure that you're getting better. They'll give you instructions on what to do if your symptoms get worse and you need urgent medical care. So this would be for things like difficulty breathing, lethargy, so not being able to move, being very, very fatigued, very, very sleepy, or if you're dehydrated. So they will give you more information on what to do if you find yourselves in these circumstances. Okay, so in terms of taking care of children's face masks, as I said before, earlier in the presentation, if you're using a non-reusable face mask and it becomes dirty or wet, it should be thrown out. If you're using a reusable cloth mask and it becomes dirty or wet, it should be cleaned. And then, so if your child has a few masks when they go to school, they can change it when they need to. We will give you a link to a website that shows you how to make masks and how to wear a mask properly. So this is also something that is really key to review with your kids before they go to school. So when you wear the mask, you should avoid touching the mask, your face, your nose. And if you do take off the mask, you should wash your hands before taking it off, and you should wash your hands after taking it off and before putting the mask on again. Another question that you might have is which schools may be most at risk of a COVID-19 outbreak? So Toronto Public Health has actually done some analysis on where they expect the rate of transmission of COVID-19 to be the highest. And they have made a list of the highest risk neighborhoods for COVID-19. So if you're interested in knowing which schools are affected, likely to be affected by COVID-19, we have a link to the list in our presentation, and we can show that to you at the end of the presentation. All right, so when kids return home from school, what measures should you take, and what about clothes and backpacks? So you want to encourage your kids when they get home to wash their hands first thing. And if there's any objects that they are frequently touching throughout the day at school and bring home, then those should be washed as well. Kids are going to be asked to limit the number of personal belongings that they bring to school to try and reduce the chances of virus transmission. And kids will also be asked to keep their backpacks stored in a cubby or a locker away from other backpacks. So that may look a little bit different depending on the school that you're at or the grade that you're in. But the idea is to have a separate area for your personal backpack. The other important thing to talk about with your kids is to avoid sharing personal items. So that could be food, hair elastics, water bottles, pens, pencils, those kinds of things, just for personal hygiene reasons and to reduce the transmission of the virus. Every kid will have their own and won't share them. All right, so there's also questions around using a face shield or a mask or a face shield and a mask. So what I can tell you is that the masks are the recommended face covering, and there's no evidence that a face shield is effective in providing protection against the virus when it's used alone. So kids are not expected to wear face shields. It's not a requirement. Masks are a requirement to wear for kids from grades 4 to 12, and a face shield alone is not acceptable. There may be exceptions for kids with medical reasons, but for most kids, the masks are what will be worn. Some families may have children with allergies or with asthma. So if a child has a chronically runny nose or chronic cough because of a health condition, you can still attend school. And if those symptoms are new, or if the cough is getting worse or the runny nose is getting worse, then the child will need to stay at home and get tested for COVID-19 and have appropriate follow-up that way. All right, so on the topic of vaccinations, this is still a really important thing to do during this pandemic. The reason being that the vaccines that are given help to prevent common and serious diseases from spreading and affecting children. So school vaccines will be resumed in grades 7 and 8 when school begins. So kids will be offered the routine vaccines. And younger children who are not school age, who need their vaccines, are also encouraged to contact their clinic to find out when they'll be able to receive them. And so routine immunizations are really, really important for spreading other illnesses among children and adults. The only thing that would prevent you from going to get a vaccine would be if you had respiratory symptoms or symptoms of COVID-19, in which case you would be asked to stay at home, get tested for COVID-19, and follow up the next with appropriate steps depending on whether your test was positive or negative. And I believe, and Elisa can let you know later, I think that FCJ will be having some vaccine clinics later on, and they will let you know if they're doing that.
Yeah, that's true for all of our patients and clients. We will be having available this flu shot, and in the moment that we have it ready, we're gonna let you know through our website and also by email.
Great, thank you, Elisa. And then, so just to segue into the flu shot, so we definitely recommend getting the flu shot this year. It's going to help to reduce the spread of influenza virus, which is also a respiratory virus, and help to prevent your children and yourself from getting sick during the fall and winter months this year. So I just want to summarize what we talked about in this presentation and summarize the most important steps that you and your family can take during going back to school to help keep yourselves and everyone safe. So the first thing is to go through that daily checklist at home of COVID-19 symptoms before leaving for school. And if you have any symptoms or any concerns, then don't go to school, go and get tested for COVID-19, and then follow up with the advice from Toronto Public Health. This is really an important step for reducing the transmission of the virus, because the earlier that we can catch the virus, it means the less people that are in contact with you while you might be contagious, and the less likely that it's going to become an outbreak in the school. Please also talk to your children about wearing a face mask, teach them appropriate techniques for taking the mask on and off, and avoiding touching their face, nose, eyes, mouth, and the mask as much as possible. Go over the instructions on how to wash your hands properly, and talk about the different times during the day when hand washing is important. So before touching the face and the mask, after touching the face and the mask, before eating lunch, after eating lunch. Those are all important moments of hand hygiene. And then there's a couple more steps. So just going over again with your children how to practice safe physical distancing. So being 2 meters apart from other people who are not in your social circle. And so being 2 meters apart from other people in the small learning groups in classes is important. And not sharing toys or books or pencils with other classmates. And then important also to talk to your children if they develop symptoms, of COVID-19, that's okay. They should know, there's a plan. The school has a plan. We're going to go through, an appropriate protocol. We'll keep everyone safe. We'll keep you safe, and other children and staff members safe. And it's okay if they develop symptoms of COVID-19 or of it may be another illness. And we're just going to go through a routine checklist to help keep everyone safe. So just to try and reduce the stigma around the symptoms, because I think a lot of kids could have stress around that. And so that brings us to the next point, which is just that, check in with your children, talk about COVID-19, talk about the things to keep them safe, the things to do if they develop symptoms, and this will help with stress levels. All of the schools have staff members who are working very hard to create appropriate plans and protocols if kids develop symptoms at school or at home. And they've been working on this for months, and they have public health nurses that will be helping in the schools. And so there's a very good plan in place to keep everyone safe this year. So just to finish off, in Ontario, all elementary schools from kindergarten to grade 8 will be open 5 days a week. Kids will go to school. Parents will still have the option to choose not to send their kids to in-person school this year. But if they choose not to send their kids to in-person to school, then the schools will be giving remote delivery of instruction to kids. You should refer to your school for the specific start date. Some of the schools are going to start on September 14th, but your specific school will have more information about the start date for you. Secondary schools in school boards that are designated as higher risk by the province will open on an adapted model. Class cohorts will be smaller, and kids will be going to school on alternate days with remote learning on other days when they're not at school. So here, Elisa is just showing you the list that you can access of schools that are located in higher risk neighborhoods for COVID-19 transmission. So this is just for your information. You can look and see if your school is on this list. Then we have a couple more information resources for you that we're going to show you. So one of the ways that you can try and help protect you and your family is to download the COVID-19 Alert App. So this is a government application that you can download on your phone. And what it does is it will alert you if you have been in close contact with someone who has a positive COVID-19 test. So this is an anonymous app. So you will not get information about who was the close contact, and they will not have information about you if you are diagnosed as positive, but you will get an alert if you have a close contact. So this, if you're able to, this is a great way to help with contact tracing and follow up. There are some mental health resources that are provided by Toronto to help with stress and anxiety. You can click on this link and it will bring you to some of the different options for mental health resources. One of them that I can draw your attention to would be the Kids Help phone. and so that may be particularly relevant for children if they're experiencing anxiety or stress. And also to note that if you do want resources, the other excellent place to go is to call FCJ Refugee Center so that they can help you find an appropriate mental health resource. Here's some more important contact information for you. So if you develop symptoms of COVID-19, you can call Telehealth Ontario, and the number is listed here. If you have questions about COVID-19, including about your symptoms, you can actually call the Toronto Public Health Hotline, and they provide translation in multiple languages. You can also email them, and the email address is on the slide. If you're very sick, you're having trouble breathing, you're having severe symptoms, you need to call 911 so that you can have urgent medical care. So here we're just going to show you a resource that talks about how to make or sew your own mask. So this is a Government of Canada website, and it's going to show you a couple of different methods for making masks so that you can have masks for yourself and a few masks to send to school with your child. So we'll let you go over this at home, but we also just want to show you, there's also a video on how to properly wear a mask, and we'll just link to that now. And then, so how to wear a non-medical mask or face covering properly. There's a very short video. I encourage you to watch it with your kids, to practice at home before going back to school, to practice when you're going out to the grocery store. Those are all great moments to practice the routine so that it becomes a normal thing rather than a stressful new thing. So I'll let you watch that at home. And there's just another slide here on how to use a water fountain. Some schools may not have water fountains available. For all children, you should all bring a water bottle to school. I encourage you to stay hydrated. And if water fountains are available at school, what will be expected is that you fill your water bottle at the water station and do not drink directly from the water station. Clean your hands after touching the water fountain, stay 2 meters away from anyone else who is waiting to use it, and drink lots of water to prevent dehydration. These are the clinics in Toronto that are available for non-insured patients. And I don't know, Elisa, if you want to add anything additional here.
Of course, yeah. Well, these are the resources that are providing right now care for all the individuals who doesn't have insurance or health card. You can contact them at any time in order to book an appointment. And also the Jane Street Clinic, who is located in Walner at the second floor, it is attending walking attendances Mondays and Thursdays, so you don't have to book an appointment if you are planning to go there, but you have to live in Toronto. And for the Queen West Community Health Center, you have to call them in order to book an appointment, and also for the Canadian Center for Refugees and Immigrants. And very important for all the women who doesn't have healthcare provider, you can also go to the Immigrant Women's Health Center, and they are booking appointments, so you can go there. And also you can contact us at any time if you need more information or if you have more questions about this important information. And regarding who can access to these services, as we said, people without any status, people who don't have a primary care provider, and people who are in their 3-month wait period for OHIP. Right now, that period of time is kind of suspended. But anyway, if you don't have the OHIP right now, you can access to these clinics as well. And obviously people who lives in Toronto, actually. So we will prepare at this time to answer your questions or inquiries regarding what we've been talking about. And remember that you can always contact us for more information. You can contact me at any time at my email or my phone number with the extension 230. And also you can reach Loli Rico, which is our co-founder. So you can also reach us at that information. I'm gonna leave this slide right now just in order that you can have all the information, and I'm going to proceed with the questions, and Dr. Kate is gonna help us answering all of those questions. So as I said, you have a mini toolbar who is located on the right side of your screen. And if you have any questions to do, please feel free to do it, and Dr. Kate is going to be more than happy to help. Okay, I think we have just a couple of questions here. Okay, hello.
Mhm.
Who will provide flu shot? Well, if you just call to FCJ Refugee Center, we can help you, and also Dr. Kate could be a little bit more deeper on this.
Yeah, so there's usually multiple places where you can get the flu shot. I think FCJ Refugee Center would be a great resource for this. The flu shots will probably be available in probably October. I believe that FCJ will have that information on their website when they're available. And if it's fall time and you're not able to get to FCJ and you're wondering about other places where you can get the flu shot, I would encourage you to contact Telehealth Ontario. So one of the numbers that was on the screen a few slides ago and that you'll be able to access after the presentation. You can just call Telehealth Ontario and they will be able to give you some more information on how to access your flu shot.
Of course. The next question is, can we get a copy of the presentation? Yes, the presentation is going to be available after we finish this webinar on our website, and you can access to this information as many times as you need. And also we will have this information about the webinar, this session webinar. It's going to be shared on our YouTube channel, and also it's going to be shared in our podcast. So of course you have access to this information. There are no more questions. I just want to encourage people and to all of the attendees that are here right now, do as many questions as you want. Dr. Kate is here just in order to solve everything or try to answer as much as possible all the questions that you have. So I'm gonna give like a couple of minutes just in order to see if there are more questions. If not, we will finish this session. No more questions coming. You want to wait a couple of minutes more? That's okay.
I'm happy to give it a couple more minutes if people have questions. I know yesterday there was a question about lunchtime and whether kids would be able to take off their masks at lunch. So I tried to answer that during the webinar today. But just to recap on that, you know, kids will be you know, able to eat lunch without their masks on. They'll probably either remain in their classrooms for that or be outdoors if the weather's nice. And lunch times will probably be staggered so that kids, if they need to use the washroom to wash their hands, won't all be there at once. And while eating lunch without masks on, we'll just try to maintain physical distancing as appropriate. One of the things that we could do, Elisa, while we're waiting to see if there's more questions, we could show that video on how to wear a face mask properly, if that's possible to do on the webinar.
Yeah, there are a couple of questions here. Somebody's asking, when is the school starting? Because we didn't get any update. We just said that in our,
So
yeah.
I would encourage you to call your school to get that information, because I know that school will begin on September 14th for many schools. I think this may be also, this information may have come from the Toronto Catholic District School Board. Is that right, Elisa?
That's right. Yeah.
Yeah, so if you go to another school, so the Toronto District School Board, then the information may be slightly different. And I would really encourage you to get in touch with your specific school, because some schools may be starting on September 8th and other ones may be starting later. That's really a school specific thing.
For sure. There's another question here. I was wondering if the information you provided applies on other district school boards like Halton. We are in Peel.
So the information that we provided, I mean, we tried to make it as general as possible to like Toronto and the surrounding regions. So it comes from the Ontario government, the Toronto District School Board, the Toronto Catholic District School Board, and Toronto Public Health. So all of these measures that we talked about will apply to all of the schools. But as we were saying, like earlier, there may be the ways that the schools choose to enact physical distancing may be slightly different for even each school. So for more specifics than those that were in the presentation, your school will help you with that. But the basic things like screening your child every day, wearing a mask, physical distancing, hand hygiene, all of those will be similar for all of the schools in Ontario.
Okay, there are more questions here. I was wondering if the information, oh no, that's the same one. Can you please email the links for the videos? Sure, just provide us your email, and also you can find this presentation at our website, www.fcjrefugeecenter.org, and you can find that information. And I'm also sharing the information right now on the screen, so you can take the information over there. Is there any way we can have this presentation in Arabic? I think so. Yeah, just let me just let me try to talk about this with the staff, and for sure, in the moment that we have it, we will provide you the information. And I think that's it. There are no more questions. I don't know if people have more questions. Please type your question, and we will be very happy to answer that. Do you have in URDU as well? I don't know what those URDU means.
Maybe does that mean, is it in, do you have the presentation in Urdu? Is that
Oh,
what the,
Urdu.
like in the
Okay.
Urdu language? Is that what the question is?
Yeah, Hindi, Urdu. Yeah, no, we don't have it, but we can try to figure it out and to see if we can do it for sure.
And Toronto Public Health actually has a couple of general COVID-19 fact sheets that are available in multiple different languages. Unfortunately, not all of their information is translated into multiple languages, but they do have a couple of basic fact sheets in multiple languages. So if it's helpful, I could send you the link to that, Elisa, and then you can access, people who wish to see the information in different languages can access that web page and click on the language that's applicable to them.
Yeah, for sure. Yeah. So for the person who were asking about the Hindu Urdu presentation, Dr. Kate, as she said, is gonna providing some links, and I could send it to you, and also we can share this link on our website for sure. So there are no more questions, Dr. Kate. I don't know if you want to add something.
Just I'm really happy to have been able to present this information to you today. Thanks once again for inviting me to speak. And if you have any questions or concerns, please get in touch with FCJ. And if it's a medical question, I'm sure that one of the doctors there or I would be happy to help you with answering any of your questions or concerns.
Thank you very much, Dr. Kate. And I just want to add some important information. Right now, the primary care clinic of the FCJ Refugee Center is working only by phone appointments, and you can contact me as many times as you need. And after your phone appointment, the doctors will decide if you will be seen in person, if that's the case. So please, if you need to see a doctor, in this case, a family doctor, we are more than happy to help you. Just call our numbers and we will give you all the information. So, Dr. Kate, I think that's it. There are no more questions. So, thank you very much for listening and watching this webinar. Thank you, Dr. Kate, for hosting this webinar for us today. And have a
It's a
great day.
pleasure.
Thank you.
Everyone stay safe. Okay.
Stay safe. Thank you. Bye-bye.